Council, would you like to certify the agenda?
Certainly. The attorney's office has reviewed all the items on today's agenda and they meet legal approval.
Okay. I have nothing to disclose for today's meeting. Does anyone, Kim, do you have anything to disclose?
No.
Laura?
No.
George?
No, sir.
Linda?
No.
Okay. I think am I missing any? Nope, I don't think I'm missing anybody. Okay. Then let us go into the consent agenda. Has everybody reviewed the meeting minutes from last meeting?
Yes. Yes.
Are there any revisions?
I have none.
Okay. Seeing none, I would accept a motion to a motion and a second to adopt the minutes.
I have a motion to adopt.
Have a motion to. After you, Commissioner.
I have a motion to adopt the minutes from the December 14th, 2023 Board of Health meeting. Thank you, Commissioner Teal.
And I will be happy to second.
Excellent. Mr. Pratt, can we do a motion and second and then one just vote, or do we need to go through on the consent agenda and vote on each item?
Typically on the consent agenda, we ask if anyone would like to pull anything off the consent agenda item. If they do not, then we can approve all items on the consent agenda with a single motion.
Okay, let's do that. First, would anybody like to pull anything off? Seeing nobody who would like to, seeing no motion to pull it off, I would now accept a motion to accept all three items. Commissioner Thomas has made a motion. Commissioner Teal looks like he's wanting to second. So all in favor, say aye.
Aye.
Opposed? Fantastic. Director Hill, we are on to your update.
Okay, and I'm trying to make it open on my computer so I can remember what I wrote. With little success. So I'll just try to remember what I put in there. So we've been still doing a lot of work building the health department. We had a little bit of a turnover issue. Adams County lost a bunch of people. So several of our former Tri-County employees bailed out and went to Adams County for what they thought was better jobs or a little more money. So a little bit of bump in the road as far as staffing, but making pretty good progress right now in staffing back up. We also lost the health administration manager, and I've reconfigured that position. And so Bryn, who was our administrative assistant, is now the office manager who supervises all of our clerks, including being the chief deputy registrar of the Vital Records office. And then Janelle, who I don't think is on here. Yep, she is. Janelle has been our accountant. And now she is the accounting supervisor and in process of hiring an accountant to work for her. So we're kind of streamlining. We took away one manager, but created two advancement opportunities out of it. So I think we're doing a pretty good job of advancing people. And Kim and I had a meeting a while ago, and I think we were like 9 people have been promoted since we've started, and that's pretty good for a 2-year-old organization, I believe. So trying to do things to give people a chance to move up and do a little bit better without having to go to Adams County to work. Let's see, and my computer is still not opening up that file. I must have it all tied up with Teams. I'm going to lots of meetings, as has been the case before. Week after next, I'll be at the Congress on Healthcare Leadership in Chicago, where I'm hoping it will not be raining and cold. Later in April, I've been invited to have a free ride to a conference on public health law that'll be taking place in New Orleans. So I get a free trip to New Orleans in a period of time when it's probably going to be rainy, but I'll deal with that. I did have in the agenda, I attached a little flyer from CDPHE. I know some of you, maybe most of you, have done your required Board of Health training, but I'm complying with their request to keep reminding you until you do it. So the flyer's in there for those of you who need it. And they'll keep bugging me, so I'll keep bugging you. So there we are. We are still looking right now. The county has discovered or remembered or somehow has decided it needs to have a place for the new judicial district. And since they're doing that, the facilities is looking at putting us in the same building they're looking at for the judicial district. So we may be moving sometime later this year to a different building in Lowtree than one of the ones we've looked at before, but that's looking fairly positive right now. I did have some information in my report about the Vital Records Office. I mean, the production by the staff and the amount of revenue they're bringing in is almost double what I had projected when I put this plan together for this organization. So they're doing a really outstanding job there. And there's enough money in there that I'll be later in the agenda asking to add another clerk. So we have a backup. Right now we've got, a number of customer service locations, and the only one that has a backup is Vital Records. So I want to use the Vital Records money to add another clerk in there and cover the other positions so people can not feel bad about taking the day off, or we don't have to feel bad because we have to do their work while they're gone. So there'll be more on that later for you to vote about. And I'm kind of rambling because I'm trying to remember what I wrote like 2 weeks ago on this agenda item, but I think I've covered the high points and happy to take any questions.
Are there any questions? Just real quick, are we coming out of flu season? We should be, right? And
I forgot that I did put a little respiratory disease update in there. It appears that everything has peaked already for the year and that those peaks were significantly lower than last year's peaks. So if you remember last year, we had a really big RSV issue in the fall around November. That didn't materialize in the same way this year. It's gone down. Also, the meningococcal disease that was happening in Denver and surrounds has not impacted us at all. And that outbreak appears to be tapering off. CDPHE and Denver have stopped hosting meetings about it, so they seem to think they have it under control.
I saw I think a couple of weeks ago, CDC put out something, I believe, with respect to COVID, and it appears their instructions were just treat it like every other respiratory disease. Is that an accurate representation?
I think that is accurate, yes, sir.
Okay. So when we were previously treating it like every other respiratory disease, we had it right.
Well, I'm not. CDC would tell you that during the pandemic, probably a little more effort was needed, but you might be right. I'm just not going to be quoted in the media as saying CDC was wrong. It's not a good look for me.
Would any other board member like to take that opportunity? I'm kidding. I'm sorry. This is a recorded meeting. I just wanted to. It appeared. I saw that and it struck me as being notable, and I wanted to ask you if I'd interpreted it correctly. I'm done. Are there any other questions from anyone else?
No, I would like.
Commissioner Thomas and then Linda.
Let Kim go first.
Or Kim.
Thank you. I just wanted to thank Mike Hill for helping me. I was just wondering, I'd heard that there were some increases in TB as well. So he kind of sent to me the TB dashboard that is provided through Denver Health for us, which while it is data, it doesn't have a lot of granularity to it. In other words, it doesn't break down like who are the most complex drug resistant type of TBs, which are the ones that are very resource intensive, and with people moving around and being so mobile, I had an interest in that. It still looks like while it is increasing, it's fairly small numbers, but it's hard to kind of tell because it sounds like they're fairly short staffed at Denver Health too, and trying to track some of the data. But I appreciate everything that he's been doing as far as helping to track some of these outbreaks that are happening with so much migration going on in the area, as well as the efforts that you've been making towards supporting your staff and your staffing matrices, as well as finding grants to be able to support some of these conferences you've been sending your staff to. Much appreciated all the work that you've been doing.
Thank you. Commissioner Thomas?
Thank you, Mike. I wanted to thank you for all the really good information, the reports that were in the packet that I read. I thought it was interesting. It pointed out that staff had reviewed 92 restaurants in the last year, and most of those were new builds in Douglas County. And the report also said that since December 6th, there have been 20 more applications for new restaurants. So I think that not only shows the health of our economy in Douglas County, but it also talks about the important work that Douglas County's health department is doing to support the needs of our county. In one of the previous reports, it seemed that we were behind in doing restaurant inspections, and you explained that there was such a big backlog when Tri-County left. Would dissolve that you were trying to clean up. And so I appreciate seeing all this new work that's going on. The report did talk about the tornado crisis, and then it talked about a hospital loss of water supply. Do you know what that is? And can you give us a quick explanation of what that was?
I do know, but Mr. Surbeck was there, so maybe he'll chime in and give us a little spiel on it.
I would be interested, John, if you have a minute to explain what that is to us.
I do. So over the last 6 months, 2 hospitals have had difficulties with their water supply. One involved a break in the supply, and the other one, there had been some ongoing problems that were associated with the plumbing on the 4th floor. And so as the process of identifying where exactly that problem was originating, they had taken a number of rooms out of service as they kind of retrofitted and went back. Those repairs have been, the more recent one that I'm speaking of, have been underway for a period of time, and they're almost done. And it has not affected patient care that we're aware of.
Thank you. I have nothing else.
Thank you, Commissioner. Anyone else? Any other? Okay. Well, let's move on to our action items. Mike, or Director Hill, do you want to talk about the action items? I trust everybody's reviewed them, but you want to sort of let's walk through each of them. And first one up is the public health order, which we passed that last year, I believe, and we made it interim to provide you the opportunity to sort of make sure that, you know, we got it right, basically, and give you the opportunity to talk to some stakeholders to ensure that there's not some unintended consequence that would arise out of it. I think we've spoken, and you've sort of discussed with me the outreach that you've done. That I don't believe you've made any changes. If I'm wrong on that, please correct me. And that we are basically taking the interim off of it and making a permanent public health order. So, Director Hill, if I got any of that wrong, please tell me.
You got that right. One other change that I made was in the original, we had a whereas that mentioned that your board was going to create a committee. That committee never materialized, so I took it out of the public health order so that the order was accurate, but otherwise it just makes it permanent, and a permanent order we can revoke whenever we feel it needs to go. But this way we don't have to worry about coming back for more reviews. And I did not find any stakeholders that were objecting to this. Granted, these stakeholders are not as easy to find as like the restaurant people that we own permits on, so we can track them down. But I didn't identify anybody who had a problem with this.
Are we, what is the activity? We keep, they're keeping news stories that pop up here and there, that there was Adams County where it appeared that Denver, not intentionally, but had housed some migrants in Adams. Again, not intentionally. It was a matter of just not understanding where the county line was. I think there was some issues in Aurora. I believe I've heard Lakewood. I don't know that anything ever materialized there, but there was certainly some activity in Lakewood. And then I saw something in Colorado Springs recently. What is the status of? Have you heard anything in addition that would lead you to believe that Douglas County could be a landing spot? What do you give us some feedback on what may have changed over the last several months?
Yeah, I've not heard anything that leads me to believe Douglas County would be a target, because basically, where would you send them in Douglas County? The Marriott's not going to fill itself up with migrants. But I did hear from the Northeast Colorado Health District is copying our public health order because they're concerned with their meatpacking plant that people will be sent there for jobs and they'll inherit some migrants. So certainly, there's concern from surrounding counties, and there have been some efforts to move people into surrounding counties, but so far, nothing has been headed our way that I can identify.
But in the event, the event that something unique were to happen, that somebody were to want to, an apartment owner or somebody else would want to just get a revenue stream, and decided that one of the ways to do that was to bring in migrants, they would have to comply with this order. Correct? In other words, we won't be caught unawares if somebody comes up with a unique way to house migrants.
Well, I mean, certainly the public health order endeavors to have people notify us. It still could happen that some sneak in under the radar and we'd have to find out, but we have that mechanism to try and make it right.
Okay. Commissioner Teal.
Thank you, President Benevento. I do appreciate the feedback from Director Hill in terms of what his colleagues across the state are saying about it and the feedback he has received. Mr. President, this still remains a persistent concern among our population. And even though geographically it may seem we are not at risk of having an Adams County situation where migrants were moved into a hotel in error, the situation in Aurora, and we've heard from several of the members of the Aurora City Council in recent weeks, that even though that was a pre-coordinated housing of migrants in Aurora, there is dissatisfaction that the full terms of the pre-coordination are being adhered to. And so given the activities that we are hearing from our fellow elected officials in local government, and given the persistent concern that continues among the people of Douglas County, I do think we have good cause to retain and extend this public health order.
I wholeheartedly agree. And Director Fielding.
Yes, I absolutely agree with Director Teal. I have been in Denver recently. I still have some ties with the university, and I've seen some of the problems that Denver Health has had, talking with people that are still working there. And city is in financial distress. It has closed 4 shelters, and you're now seeing tent cities in parts of the city under overpasses. I could easily see an NGO trying to bring some people in with good intentions, but not necessarily following the rules. So I think we have to have this order, and I think we have to address concerns.
I wholeheartedly agree. And, the fact that we're doing this without an imminent threat doesn't detract from the order, it actually supports the rationale for doing it, is that we need to prepare in the event that there is, you know, somebody comes up with a way to house migrants that, you know, we hadn't anticipated. So I think it's an important order, and, you know, I think the order is, the order is necessary because our obligation, of course, is to protect everybody in Douglas County, migrants or not, but also certainly existing Douglas County residents. Any other comments on this?
I think it's important to remember that this covers all of Douglas County, just not unincorporated portions of Douglas County.
Yes.
Good point.
Well, Director Harrell, is there anything you'd like to add before I call for a motion? And well, before I call, let me do this. Is there anything you'd like to add before I ask for public comment?
No, I'm fine with this. I did put in the chat a reminder, we skipped the item for our annual report before we jumped right into the action. So I'm sure Richard is dying to do his presentations. If we could go back to that after this or at some point, that would be good.
Oh, did I? Sorry, yep, I did. Sorry, I'm looking at the agenda on my phone and it's not as clear as otherwise. Yes, let me do this. Let's go to public comment. Let's take a vote on this, and then we'll go back to the the annual report. Do we have any public comment on this item? Hearing none. Is there any? Well, so we have no public comment on this item. So I would seek a motion in a second to the. I have a motion, or Director Teal, is that a motion?
Yes, Mr. President, please the board. I do have a motion to make the public health order regarding housing migrant persons in Douglas County permanent rather than interim.
Do I have a second?
I would like to second.
We have a motion and a second. All in favor, say aye.
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 Opposed? Wonderful. Okay, now let's go back to the regular agenda that I skipped over. Let's go back to the 2024 to the, I must be looking at it. Let's go back to the annual report, presentation on the annual report.
Rich Miura is going to do that presentation. He's our performance management specialist.
Thanks, Rich, for doing this. My apologies for skipping over you.
Thought I got lucky, but no, I appreciate it. So my name is Richard Miura. I am the performance management specialist for Douglas County Health Department. I've been there since last June. I was given the opportunity to actually work on this annual report for 2023, which has been pretty exciting because I got to gather data from all divisions that was important to them, and then put it in a simplified version so that public can easily read it, and also anybody else could. I'm sure, I think you guys got the PDF document. Normally I would have printed it for you, but let's see. Let me start with sharing my screen. Here. So this is the simplified version of the actual report. So we will have the report online. Positive when it should be next week, possibly. Don't quote me on that. But all right, so let's begin by providing a brief overview of the key highlights from the report. So Douglas County Health Department's vision is that Douglas County residents have access to opportunities for achieving their healthiest possible lives. And our mission statement is that we provide education and evidence-based services to improve health in the Douglas County. These guiding principles steer our actions and decisions and driving us to make a positive impact on the lives of our residents. Then the administration portion of it, accountability and transparency are important in our operations. We've carefully managed the resources entrusted to us, allocating funds to programs that directly contribute to the health and vitality of our community. So while we're 50% grant funded by the federal and state government, we are also 35% funded by the county. Here's a breakdown of just percentage-wise of the revenue and expenses for each area. So the issuance of vital records is also a critical aspect of our services. In the past year, we facilitated the provision of vital records, ensuring that our community members have access to essential documents vital for various life events. We issued over 7,000 birth records and over 1,600 death records. We also talked about WIC in there, which is our Women, Infants, and Children's program, which continues to be a cornerstone of our commitment to the maternal and child health. In this past year, we've actually proudly served 3,058 families, ensuring access to nutrition and support that is crucial during the formative stages of life. Along with that, we also have the maternal and child health, which is MCH. It also remains the forefront of our endeavors. We've organized and participated in numerous events and outreaches, 14. We've also established 4 bookshelf locations, distributing over 5,200 books, creating education and support for mothers and children in our community. Then we also have like a heartfelt testimonial from a member of our community, basically highlighting the positive impact of our services we've had on their lives. Let's see, I mean, I could read it real quick. The books that the Douglas County Health Department provides have been very well received by the clients who frequent Secor. Secor is primarily a food pantry. However, with the introduction of a small library, we were able to create, with the donations of the Douglas County Health Department, we have put so many books in the hands of children, many of who do not have many books at home. When our market is open, children are often in the waiting area, reading a book alone with a parent or with a sibling. This additional opportunity has been very well received by families. That was Debbie Blair from Secor Cares. And then also along that, in collaboration with the Boy Scouts of America, we launched what's called the Little Libraries Initiative. It's promoting literacy and community engagement. It's open 24 hours a day and 7 days a week. And these libraries provide access to books for all the community members.
Do you guys partner at all with the actual library? You know, I get the idea of having books there while parents are shopping. And the kids can read, and I think that's a great idea. But in terms of any literacy activity or sort of creating greater access to books, do y'all do anything with the actual library?
I'm not aware. I mean, Laura, I don't know if she's here. She might be able to talk about that if they do. Okay. I know the maternal child health actually goes to some other areas and actually does book reading.
Rich, I can jump in on that really quickly.
Thank you, Laura.
So we have definitely been working with the library to get more involved with their efforts. And although we're not actually in our libraries and their story times quite yet, we continue to have those conversations and figure out how to work through partnership. As Rich mentioned, we are taking the opportunity to participate in Sunshine and Storytime, which happens in Backcountry. And that has a lot of families, especially those with toddlers and preschoolers that attend those events. And Jean Newell, our maternal child health coordinator, goes to that event on a monthly basis and has been able to engage with families, connect them to other resources, bring books, and just make sure that we're really supporting those families and having access to those important books and those just early reading opportunities. So we're continuing to do as much as we can and just make sure that we're creating more access throughout the county with those efforts.
Thank you. Yeah, it's just so important. And like you said, early access, being read to, learning to read, holding a book, looking, it's just so important. So thank you for that. I appreciate it.
Thank you, Laura. Okay, so our environmental health department has diligently monitored and improved the metrics related to environmental well-being, from inspecting childcare facilities, over 1,100 retail locations, 20 body art facilities, and 91 plan reviews for new restaurants, plus a list of many more inside the annual report. Then talk a little bit about the emergency preparedness. Commissioner Thomas touched on a couple of these. The Douglas County Health Department responded to 4 major incidents, also more. These are some highlighted ones: the Highlands Ranch tornado, the Elbert County flood, Elbert County forest fire, and the hospital loss of water supply. Also with the EPR, they also conducted a department ICS training, which stands for Incident Command System. And they basically had like an exercise to execute a staff recognition picnic. And the picnic was to celebrate the accomplishments of the first year in operation. It was also a good training exercise for the whole department. Then, in the field of epidemiology, it plays a crucial role in understanding and mitigating health risks. And our epidemiology team has been instrumental in tracking and analyzing health trends, providing valuable insights that guide our public health interventions. And a great example is tracking the top 5 infectious diseases, which I listed from the top one to the bottom one in our actual county. So in conclusion, the annual report is a testament to the collective efforts of the Douglas County Health Department and the unwavering support of our community. So thank you for your attention, and I invite you to explore the report for a deeper insight into the achievements of the Douglas County Health Department. Thank you for your time.
Thank you. Are there any questions? Director Tom or Commissioner Thomas, I think you're on mute.
I'm sorry. You would think after 5 years or 4 years, I'd figure that out. I actually printed off the front page of that annual report when I went through it. And I thought the important part was in the 3rd paragraph when it says, I want to remember to thank the many partner agencies without whom we could not be successful. And even though Mike is really new to Douglas County and the Douglas County way, we always talk about how we are successful because we partner with everybody. We don't have silos and we fight. We don't fight with our municipalities. We all work together. And Mike, you captured that in this annual report. And Richard, I'd like to thank you. I went through it. As for my questions, you know that I read it. One thing that I thought was really interesting, and I don't know if you can explain this, on the administrative overview, it shows that the revenue is 5.8 million and the expenditures are 5 million. So there's $800,000 there. Is that what we are saving by having our own health department?
That might be one way of presenting it. That represents the addition to our fund balance during 2023. And some of that has to do with there having been staff vacancies, so we didn't spend money on staff that we didn't have. But yeah, we are banking a little bit of money right now, but there's going to be some changes in funding from the state and feds. So I think you'll see that start to dwindle a little bit. But I'm trying to make this certainly not profitable, but an organization that maintains a bit of a fund balance for an emergency.
Well, I appreciate your leadership on that, Mike. Thank you.
Excellent. Well, thank you, Mr. Mira, for the presentation. Why don't we move on to the next action item then, which I believe was the public health clerk that you're seeking approval to add?
Yes, sir. So I kind of covered this a little bit in my intro while my computer wasn't willing to show me my report to read from. But basically, as I said, we need a floating clerk because we have multiple customer service locations and we have no one to go back people up. Like if the clerk up in Lone Tree is out, there's, the supervisor has to cover that, which is not the best use of time. So I want to add an additional clerk who will be based in Vital Records. There's space for them there. but we'll also be cross-trained for all the other customer service locations so that that person can go float around and help out when there's, you know, a rush of work in one location, or if someone calls in sick or takes vacation.
Okay. And this person would be a permanent. So what? Just real quick, when they're not backfilling for somebody, what's their job? What do they do?
They'll be in vital records, and as I think we reported a few months ago, we produce almost a third of the birth certificates for the state of Colorado in that office. So that's why you see all those thousands of birth certificates. It's not that we've had an outbreak of births in our county. We're doing birth certificates for all over, because when people order them online, a certain percent of them get automatically fed to our office. So there's a lot of work going on. There's enough to keep this person occupied part of the time, but it's not that tight to where we couldn't have this person float somewhere else a few days when they need to.
Okay. And what's the total cost of this position?
That's a good question. I think they end up costing with benefits around 75 or 80. It depends on, you know, what insurance people take out, how much it costs, because the more expensive county insurance, the price goes way up. But if they take the cheap plan, then it's not as much.
Okay. I don't have any other questions. Okay. Well, I'd seek a motion in a second to approve authorizing the position of public health clerk.
I'm happy to make a motion to add one public health clerk to the Douglas County Public Health Department.
I'll second that.
Okay, we have a motion and second. Let me stop here real quick before we take the final vote. Do we have any public comment on this position? No public comment. So all in favor, say aye.
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 Opposed? Okay, I think we're good. So let's move on to the next item related to posting and posting of notices. Director Hill, would you give us some background on this, please?
Yeah, and if I get it wrong, Mr. Pratt might want to chime in, because he's the instigator of this one. But I guess each year we're required to let people know where we would post notices of our actions. And this is something we didn't do last year, but this now establishes that for 2024, those are the locations where we will post notice.
Is it changing from last year?
No, we just didn't do this kind of resolution last year.
Okay. Okay. So nothing's changing. We're not doing anything different.
No, sir.
Okay.
Mike, you covered that very well. This is Chris Pratt, but this is just something required in the open meetings law in the state of Colorado. Every year we're required to post where we're going to put information so that anyone who wants to know what we're doing and how we're doing it knows where to look.
Okay. Okay, and same question to you, Mr. Pratt. I assume it's true. Nothing is changing from how we've been doing. In other words, we're not moving any location where people have become accustomed to seeking information, correct?
Correct.
Okay. Any other questions? All right, is there any public comment on this? Okay. With no public comment, I would seek a motion in a second to accept the posting, the posting of notifications and information resolution. And Commissioner Teal, I believe, has making the motion.
Yes, sir. If it pleases the board, I do have a motion to approve resolution number R-024-001, a resolution to give full and timely notice of public meetings on the Douglas County public website.
you have a second?
Second.
A second from Commissioner Thomas. All in favor, say aye.
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 Aye. Opposed? Fantastic. That passes. So and now a request to approve funding allocations from the state received since our December 2023 board meeting. Director Hill.
Yes, sir. So since we last met together, we've received another $26,206.23 of allocations from CDPHE and the Early Childhood Agency. And they're described, one of them is just to look at pertussis. Another one is FoodNet, which looks at foodborne diseases in our jurisdiction. If you'll remember, we did ask your permission to apply for a WIC lactation mini grant. We got that, $8,000 of funding. And we also got a mini grant from the early childhood people for $6,500 that we're going to use to buy some magnets with parental information that we'll hand out to people with newborns in the community.
Okay. Is there any discussion on this item? Okay. Is there any public comment on this item? Okay, I would request a motion to approve acceptance of funding allocations from the state received after the December Board of Health meeting. Do I have a motion and a second to do that?
I'm happy to make the motion.
And
That
I have a
we,
motion. Oh, sorry.
I was going to say, I'm happy to make a motion to approve all the funding allocations from the state received since the December 2023 Board of Health meeting that Mr. Hill has identified.
Fantastic. Do I have a second?
I will second.
Okay, I have a second. I have a motion and a second. All in favor, say aye.
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 Aye. Opposed? Okay. So now, with the end of the action item section, let's just go to general citizen comment. Do we have any citizen comment on this? On anything, on any item? Oh, I have somebody raising their hand. I apologize, I can't see who it is. Oh.
Hi, Doug. It's Fran.
Oh, hey, Fran. Would you introduce yourself in the town in Douglas County
Sure.
in which you live?
Sure, it's Fran Santagata, and I live in Roxborough. And you did a fabulous job, even though you didn't think you had it. You had it. It was very well run. Just wanted to comment on the great work that continues to happen with the Board of Health. I'm always so excited to see how everything continues to move along as the months go by, and Mr. Hill's leadership has really moved the organization along. The one thing I wanted to bring to the board's attention, it's a topic area that I just wonder if it has been addressed. Just recently, last year, there was a train derailment in East Palestine, Pennsylvania, where 100,000 gallons of vinyl chloride was spilled. They then, as part of the response, tried to burn it off because they were afraid of an explosion, and that released a bunch of other chemicals that could be detrimental to the health of the people in the community, including phosgene and hydrogen chloride. And so, I just attended an after action webinar where the the fire chief spoke about some of the lessons learned. And one of the things he was very passionate about was not getting assistance from public health with dealing with the aftermath of this. He was very blunt about the CDC not providing resources, but I honestly believe that would be a local responsibility, local and state responsibility to do follow-up with people who've been exposed, and there were so many people exposed and so many people sickened by this. So it really tugged on my heartstrings to hear him talk about this. and to hear about how many people were hurt by this. And many of them were the firefighters who showed up on scene. He emphasized the fact that although they try to provide training to the hazmat responders to these small communities, and I would think of in context of Douglas County, like Larkspur Fire, they have mostly volunteer firefighters. And so the first fire department on scene is going to be a bunch of volunteers who may not even have the level of awareness or operations to be able to take those safety precautions to not get themselves exposed to some of the things that are happening on these scenes. We have very great hazmat resources with the Arapahoe Douglas Hazmat Team, but remember, they're not going to show up immediately. It takes some time to assemble the team and get them down there. So I thought those were very poignant lessons learned from this. And, you know, I think that this is something I just wanted to bring the board to the board for consideration. Thank you.
Thank you. And I think you're correct. Emergency response is, you know, one of the top issues and our appropriate role that we want to be certain that we're prepared for. So I think and I'm familiar with what happened in East Palestine, and you know, certainly you know, and I'm not, this isn't a comment meant to be critical of anybody. It's just there's always something to learn after every emergency like that. So any other comments? Any other comments from the board? Okay, well, I would accept well, first, Michael, so our next meeting is going to be in June?
Yes, sir, correct.
Okay, so our next meeting is in June. You know, with that, I would accept a motion and a second to adjourn.
So moved.
Second.
And I have a second. All in favor of adjourning, say aye.
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 Aye. Opposed? All right. Well, thank you all. And I will see all of you. If I don't see you sooner, I'll certainly see you in June. Thank you.
Thank you. Bye-bye.
Bye-bye.